If you live with an autoimmune disease like rheumatoid arthritis or any of the others, and you've ever noticed any painful bumps that are underneath your arms, at your groin, or along the inner thigh, don't just ignore them. They could look like simple boils or ingrown hairs, but sometimes they're signs of another condition, an inflammatory condition called hidradenitis suppurativa. And back in the old days when I was in training, I rarely heard about this condition, and yet I see it regularly now. Why is it showing up more often? And what does it mean for people with autoimmune disease? I'm Dr. Neha with PlantForwardMD. Let's dive in. Let's talk about how autoimmune inflammation connects your joints, your skin, and your overall health. Hidradenitis suppurativa, today's topic, sits right at those crossroads. A few months ago, one of my patients who has rheumatoid arthritis, she mentioned to her primary doctor that she's getting these boils underneath her armpits. And she didn't think of talking about the ones at her groin. She thought it could be something different. But the doctor gave her some antibiotics and it went away. But then it happened again a month later. And again, she took antibiotics and it went away. And by that time, she had seen me and she was just mentioning it in passing. And I asked her, I said, do you also have these boils in other places? And she's like, yeah, actually I do. I just assumed it was some ingrown hairs and I keep getting these infections. Maybe because I'm on treatment for rheumatoid arthritis. So I asked her to see a dermatologist and she was given this diagnosis of hidradenitis. Now, usually this condition is most often seen in women. About 3 out of every 4 cases are women, but it can happen in men too. It's a little bit different. It usually starts in women after puberty and peaks in about their 20s to 40s, somewhere in that range. And it could be worse around the time of their menstrual cycle. So there are relations with hormonal changes, including in perimenopause and menopause. When men get HS, as it's commonly called, they're more likely to have it in the gluteal or perianal region. So a little bit different in terms of distribution, but they also tend to get more sinus tracts formed in those areas and more scarring of the tissue. Some studies say that it's almost up to 1% of the population, and yet it's often underdiagnosed, misdiagnosed, because people think it could be anything else that's going on with their skin. The average diagnostic delay is about 7 years, so really can take a while to get this diagnosed. But luckily there is more awareness about it overall now, including to rheumatologists, because we are seeing it more along with our other conditions. For example, with Crohn's disease, it can be seen more often with that. HS causes these inflamed nodules. And it's where the skin is really rubbing, like the armpits, the groin, the inner thigh, underneath the breast is also another common spot. And the important thing is that it's not about hygiene, it's about inflammation. So a lot of people are kind of embarrassed to tell their doctor or their friends or colleagues because they're thinking it's maybe they're not washing right, they're not using the right soaps, but it's not that. So I just want to make that very clear. And the different type of molecules you'll often hear me talking about, like TNF-alpha, IL-17, are also culprits over here. HS isn't new, it's just being newly recognized. So when I trained, which was over 15 years ago, we really weren't recognizing it as well, doing a very poor job of it. But nowadays, it's kind of been reframed to more of an inflammation type of condition, not just a local skin disease, and I think that has made a lot of the difference. RA patients are living longer, they're taking these immune modifying diseases. So if you're living longer and your joints are actually stable, other things also unfortunately can happen. This used to just be called recurrent abscesses. Somebody who kept getting these would be like, okay, well, they just keep getting abscesses and that's what we write down as a potential issue, but now they're recognizing it as its own condition. And yet there's an irony to it because the very biologic drugs that we use to treat inflammation in rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, Crohn's disease, in all of these conditions, they are drugs like Humira, Remicade, and some of the newer ones coming out are approved to treat HS, and yet some of these medications, they can actually trigger HS type of reaction. So here you have this medication that's helping you treat one condition, and yet it could be triggering HS on the other hand. It happens, it rarely happens, but it just reminds us that the immune system isn't a light switch. It's a network. Calming one circuit can sometimes activate a different one. And even though I've talked about biologic medications, dermatologists don't tend to jump straight to biologics. Some people don't have severe cases, they have mild cases, so you would try local treatments first, starting with warm compresses, antibacterial washes such as chlorhexidine or benzoyl peroxide. Those are commonly used. Oftentimes you can use topical antibiotics like clindamycin or some gels, or even oral antibiotics, doxycycline, clindamycin, clindamycin, rifampin. There's different combinations that they can use, especially if people are having recurrences. Sometimes if there's some really stubborn nodules, you can use steroid injections for those. And in some cases, even laser hair removal, because if the hair follicles keep getting blocked, sometimes laser might be the answer. So only when these fail or HS is really severe would generally people move on to biologics. We've also learned more recently other situations that could be coexisting are like metabolic syndrome or polycystic ovarian syndrome. And two newer pieces of information can help us explain HS flares. As I said before, flares can often worsen around menstruation or perimenopause. And two, something I often talk about, the microbiome. Changes in the skin and gut bacteria can amplify inflammation. And we don't always know the consequence. Some people, it shows up in their joints. Some people, it shows up in their skin, others in their gut. Inflammation can really be anywhere in the body. And HS has been linked to different gut disorders as well as diet quality. But knowing this can open doors for more holistic approaches as well, because lifestyle changes can make a real difference. Quit smoking, because it's one of HS's biggest triggers. Maintain a healthy weight. You'll have less friction and hopefully lower inflammation. Wear loose, breathable fabrics, and focus on plant-forward, Mediterranean-style meals that are rich in fiber, omega-3s, while limiting your processed sugar and overall processed foods. Hopefully it helps your skin and your joints heal in sync. When should you call your doctor? If the painful lumps keep returning, especially after medication changes, like oftentimes you have to find a pattern and your doctor may not always know it. You know your body best, so check to see if there is a pattern when you change something. And sometimes your skin is the first clue that there is inflammation there that's not being treated. This is incredibly important because catching HS early can prevent scarring and chronic pain. It's really a very difficult condition for those that have it. I'm sure you would know. So remember, autoimmune diseases like rheumatoid arthritis or psoriatic arthritis, they don't just stop at your joints. They are system-wide inflammation. And sometimes the way that your body is expressing that is changes in your skin. I'm Dr. Neha. Hopefully this helped. Share it with somebody else who might need to learn more about this. And I'll see you next time at PlantForwardMD.